Are you somebody who has recently had endometriosis excision surgery? Or are you somebody who has an upcoming surgery date scheduled? Or are you someone who's on the fence about pursuing surgery? Welcome back to the Endo Fertility Space channel. Today we're diving into endometriosis surgery, the gold standard management option for this challenging condition. This video will cover why to consider surgery as somebody with endometriosis, the difference between excision and ablation surgery, how to prepare for surgery, what recovery looks like, and helpful tools to have in your post-surgery toolkit. If you haven't already, please give this video a thumbs up, share with a friend, and subscribe for all the best endo content here on YouTube. So why consider endometriosis surgery? There are many reasons to pursue surgery, including fertility preservation, to restore fertility, to get a diagnosis, to reduce pain, and to improve quality of life. For many people, surgery becomes an option when other management strategies like pain management, hormonal treatments, or lifestyle adjustments just haven't provided enough relief. Let's briefly break down some of these reasons and what the research says about each. So let's first talk about fertility preservation. This profound study, albeit a very small representation of the endometriosis population, showed that teenage girls who underwent complete excision of all areas of endometriosis had zero recurrence at 2 years post-op. Recurrence was measured via repeat surgery and confirmed visually and/or through biopsy. The conclusion of the study was that complete laparoscopy in teenagers has the potential to eradicate disease and preserve fertility. Now let's talk about restoring fertility. In one study, a third of participants had a history of infertility for just under 2 years prior to surgery. Following surgery, 77% of those previously infertile patients attempted to conceive with an 80% success rate. In another study, excision or ablation surgery on patients with minimal or mild pelvic endometriosis resulted in increased pregnancy rates. In participants with severe endometriosis, randomized controlled trials also showed that surgery resulted in better pregnancy rates. Pregnancy rates were also shown to improve in women with ovarian endometriomas 4 centimeters or larger, but ovarian reserve decreased, as is to be expected. In the ovarian endometrioma group, surgery also decreased the recurrence rate of cysts. This large systematic review showed that pregnancy rates following excision surgery for deep infiltrating endometriosis varied from 40% to 68.5%. The spontaneous pregnancy rate after surgery was 50.5% in patients without bowel involvement and 28.6% in those with colorectal deep endometriosis. These results are complicated by the use of assisted reproductive technologies, as well as no differentiation between participants who were and who were not struggling to conceive pre-surgery. Lastly, this review looked at fertility outcomes from IVF pre-surgery versus post-surgery. Pregnancy rates were 1.84 times more likely when surgery was performed for deep infiltrating endometriosis prior to pursuing IVF, even when comparing women with much more favorable characteristics to achieve a pregnancy against those who had a lower AMH, adenomyosis, and/or who were above the age of 35. The latter were still more successful at achieving pregnancy following excision surgery. That's some pretty profound data. Now let's talk about diagnosis. So endometriosis excision surgery is the best method for diagnosing endometriosis of all kinds: superficial, deep infiltrating, ovarian, etc. While there are new technologies showing promise in accurately detecting endometriosis without the need for excision, these technologies are currently limited only to deep infiltrating endo and endometriomas. What makes excision surgery superior is that it leaves tissue intact, unlike ablation or burning, so it can be sent to pathology to confirm a diagnosis of endometriosis. Additionally, excision surgery takes it one step further and identifies endometriosis in 25% of atypical pelvic lesions that may have otherwise been ignored or left inside, resulting in an incomplete removal of disease. After all, in only 57 to 72% of cases is endometriosis correctly identified through visualization alone. Let's talk about now reduction in pain and quality of life. Many studies have shown the profound effect of excision surgery on pain, quality of life, sexual function, pain with urination, pain with passing stools, and more. This study, which we looked at previously, showed that 84.6% of the 239 participants who had undergone excision surgery were still pain-free over 2 years after excision. And those who did experience recurrence of symptoms, they were symptom-free for up to 2 years. This study showed that 4 months post-op for deep infiltrating endo, significant improvements were reported in all parameters, including quality of life, sexual activity, pelvic pain, pain with menstruation, rectal pain, and pain with intercourse. 46 participants in this study reported significant improvements in pain, control, and powerlessness, emotional well-being, social support, and self-image after excision surgery for endometriosis. This was reported at 4 weeks post-op and persisted up to 6.8 years. All things considered, it cannot yet be said that excision surgery is a cure for endometriosis. It can help manage symptoms and improve quality of life, but endometriosis can and often does reoccur. All right, so let's now talk about what is the difference between excision and ablation surgery. Naturally, if you're considering surgery, you've probably heard the words excision and or ablation thrown around. Let's talk about the difference between the two. So excision surgery is considered the gold standard for endometriosis. In this procedure, the surgeon cuts out or excises the endometriosis tissue entirely. Excision is thorough. It removes the endo tissue down to the root, which can reduce the chances of reoccurrence. This option often provides a better long-term relief from pain and has been shown to lower the rate of reoccurrence. In one study, the rate of reoccurrence following excision surgery was 23.5% compared to 58.8% with ablation. Surgical treatment of endometriosis was also shown to improve blood vessel function, which resulted in a reduced risk of cardiovascular disease. Additionally, a 2013 study from Sweden showed that surgical treatment of endo lowers the risk of ovarian cancer. Lastly, excision tends to be more complete in that the surgeon can access and remove endometriosis from delicate structures like the ureters, uterosacral ligaments, bowels, bladder, and major vessels, resulting in a more complete surgery. All right, let's now switch gears and talk about ablation. Ablation, also known as cauterization, uses heat or other energy sources to burn off the surface of endometriosis lesions. While ablation can relieve symptoms temporarily, it doesn't always address the deeper layers of endometriosis tissue, so the relief may be short-lived and the risk of recurrence is much, much higher than with excision. Additionally, ablation introduces more scarring and tissue damage. Endometriosis can continue to grow and worsen under that scar tissue that forms from ablation, often resulting in more severe symptoms. What's more is that the initial surgery tends to produce a better response than subsequent surgical procedures, with improvements peaking at 83% after the first surgery and declining to 53% following a second procedure. Since the recurrence rate is so much higher with ablation, excision is the better option. Let's now talk about how to prepare for endometriosis surgery. When responding to this question about how to prepare for excision surgery, I like to consider the following. What are you trying to achieve through your preparation? Is it to lower inflammation? Is it to support good outcomes on the other side of surgery? Is it to lower the effects of the inevitable inflammation that surgery will introduce? Is it to maximize chances of success becoming pregnant after surgery? Is it to minimize chances of complications or infection? Is it to support your body in the healing process? If you want to create a pre-surgery plan, the first thing you need to do is identify your personal objective. The following is a list of important considerations pre-surgery that everyone can benefit from though, so take note. First thing, educate yourself. Be an active participant in your care. Make sure your surgeon is the right one for you and is well versed in the appropriate techniques needed to perform a complete excision surgery. I have a blog which I link to below on 25 questions you can ask your surgeon to help you prepare. The second thing is optimize your health. Get in the best possible shape you can before putting your body through a traumatic event. I hate to sound morbid, but you're going to be cut into and endometriosis lesions are going to be removed from the root from the inside of your body. Your body uses the nutrition from your food and the macronutrients from your food, especially protein, to support healing. So here are some things to consider doing prior to surgery to optimize your health and support recovery. Start on a quality multivitamin. Being nutrient deficient doesn't do you any favors. Next thing, start building up your amino acid stores. Consider a cup of bone broth daily, collagen in your tea or coffee, or just keep on top of getting in roughly 80 to 90 grams of protein per day. This may or may not vary depending on your size and level of activity. Do something every day to promote blood flow. This could include, but isn't limited to, rebounding, acupuncture, heat packs or castor oil pack application. hot baths, grapeseed extract, omega-3 fish oils, or exercise. If you're regularly constipated, having diarrhea, both, or experiencing GI symptoms daily like bloating, heartburn, abdominal pain, cramping, or urgency, I highly suggest that you spend a solid 1 to 2 months working on making these symptoms better. The Endo Belly to Bombshell GI specific course is a low-cost option that will provide you with clear options to resolve all of your GI related concerns. So stay tuned for that. It's coming very soon. Next consideration is to eat an anti-inflammatory Mediterranean style diet. Aim for 3 or more color plant foods with every meal. Opt for lean animal proteins often, like turkey, chicken, fish, or eggs. Use olive oil often. Aim for 3 60 ml portions of nuts or seeds weekly. Aim for 3 3/4 cup portions of legumes weekly as well, if they're well tolerated. Aim for 1 daily vegetable serving coming from a cruciferous source like cauliflower, broccoli, Brussels sprouts, cabbage, kale, or radishes. And avoid processed carbs, sugar-sweetened beverages, and alcohol. Next consideration is to do some form of daily movement, even if it's only a short walk. Living a sedentary lifestyle slows blood flow and weakens your muscle. This is not ideal for post-surgery recovery. If you experience symptoms of inflammation like hives, swelling, pain, redness, loss of control, temperature shifts, sticky stools, or random food reactions, start now on an inflammation reduction plan. The earlier, the better. This includes a combination of anti-inflammatory strategies that could be diet-specific, supplements, or lifestyle, or a combination of all of these. Some of my favorite ways to reduce inflammation include tart cherry juice, melatonin up to 10 milligrams per day, oily fish in the diet, or omega-3 supplements, a minimum of 1.5 grams, but you can go all the way up to 3 grams per day, gentle movement, adequate hydration, 30 or more grams of fiber per day, the Endo Flare Care Relief Blend, which I'll link below, zinc, high moisture, low heat cooking methods, particularly when you're preparing your animal proteins, golden milk lattes, low dose naltrexone, colorful plant-centric meals, and excellent sleep. A couple of tips that are a little bit more specific to surgery include binaural beats or lavender for any pre-surgical anxiety. These are 2 science-backed supports that can help calm any surgery-related stress or anxiety or concerns. Lastly, follow all food and drink avoidances. Usually the guidance that you'll receive is no food or drink after midnight the night before. If you're given an antibiotic pre-surgery, I will link to some antibiotic-associated diarrhea prevention probiotic strains in the notes below. Taking one of these can help mitigate nutrient loss and reduce inflammation. The next thing to consider is plan for aftercare. Another thing it's wise to do pre-surgery is prepare for aftercare. You will be tired, likely constipated, and in pain. Your mobility will be limited also. Now is the time to prepare soft protein, nutrient-dense meals to pull from post-surgery. Now is also the time to arrange for childcare or other responsibilities. Speaking of preparing, prepare also for your hospital stay. For most of us, endo excision surgery will be a day surgery. If you've had a more invasive surgery, you may require a short hospital stay. Here are a few things you might consider having with you in your hospital stay bag. Body pillow, comfortable undergarments, period undies, soft nightgowns or baggy t-shirts or baggy clothing in general. You just don't want any clothing that's going to be pressing on your abdomen or any kind of like tight elasticy waistbands, slip-on shoes or slippers, heating pads, a long phone charger, a hat or flattering headband, eye mask, blanket, a comfy robe, face wipes, a toothbrush, throat lozenges, toothpaste, chapstick, hairbrush, gum, and deodorant. Now let's move into talking about recovery. You are on the other side of surgery. Congrats. Please remember you just had surgery, so be patient with yourself and give yourself time to heal. Most people will not experience the full benefits of the surgery for 2 to 3 months post-excision, but it can take much, much longer than that also. Be mindful that it is very common for your periods post-surgery to be more painful and uncomfortable, so here are my top tips for post-surgery recovery support. The first one is be prepared with bowel aids to help with bowel movements. Anesthesia is notorious for slowing blood flow and causing constipation. Do not allow yourself to stay constipated for too long, as this will worsen your pain. My top recommendations here include 1 gram of ginger in capsule form, traditional medicinals ginger tea, Herbatox, colon cleanse, motility activator, 5-HTP, Modal Pro, and or partially hydrolyzed guar gum. But if you opt for this option, just keep it very small and conservative because high fiber can be a little bit irritating post-surgery. The next consideration is that gas pain is one of the most unpleasant post-op experiences. If you've been there, you know what I mean. Gas-X, peppermint capsules, enteric coated specifically, ginger, the St. Francis Herbs gas and bloat product, traditional medicinals belly comfort tea, and activated charcoal are awesome aids to have on hand to help with gas pain. Also, a hot water bottle or heat pack applied to the shoulders and or ribs can be very helpful for relieving some of that discomfort. As soon as you're able to, there is nothing better than movement to move that gas out of your body. Lastly, carminative tea, which is equal parts anise, fennel, and caraway seed. This is a fantastic at-home remedy that you can make yourself to support removing gas from the body post-surgery. Next thing to consider is to promote blood flow with things like movement, heat packs, castor oil packs, fish oil supplements, grapeseed extract, trans-resveratrol, ginger, CoQ10 acupuncture, and or nitrate-rich veggies or nitrate-rich veggie juices. The nitrate-rich veggies increase nitric oxide in the body, which dilates blood vessels, and that's how they support blood flow. Poor blood flow is one of the reasons your sex hormones remain low 4 to 6 months post-op. If you want to restore blood flow faster, consider these options. Next consideration is that it's normal to have pain with urination or passing stools post-surgery. 1,000 milligrams of vitamin C paired with 800 international units of vitamin E or up to 10 milligrams of melatonin are science-backed supports to improve pain. Protein is key post-surgery for healing. Aim for those lean, soft sources like yogurt, kefir, cottage cheese, pressure-cooked chicken or fish, canned fish, eggs, collagen, and bone broth. Now, I know this is a difficult ask, but if you can avoid pain meds post-surgery, do it. Pain meds sedate the bowel and can contribute to slower bowel movements and poor elimination on the other side of surgery. So what are some recovery items to consider having at home post-op? Wedge pillow or body pillow, comfortable clothes that do not push on the abdomen, panty liners, period underwear, baby wipes, squatty potty, ginger tea, heating pad, a stepping stool if you have a high bed, compression socks, biofreeze or a roll-on gel for pain or gas pain, magnesium, large ice packs, or a mattress gel pad. Some helpful food items to have on hand include soft proteins like pressure cooked or shredded chicken, yogurt, cottage cheese, eggs, canned tuna, fish, and edamame, canned soups, mashed potato, applesauce, oatmeal, straws, bone broth, collagen, and various teas, but especially ginger, peppermint, and carminative tea. So what are some final considerations? Hormonal suppression pre-surgery, especially when coupled with an inexperienced surgeon, can result in missed endometriosis. In general, hormone suppression, including Lupron or Lissa or even birth control, can make endometriosis harder to see. So come off and definitely don't start hormone therapy prior to excision surgery. A good comprehensive surgery can take 2 to 5 hours, so consider asking your surgeon about the expected length of time in surgery. If you're getting any sort of impression that the surgeon is rushed or that their office is very busy, this could be a sign that they don't have enough experience to perform a comprehensive excision surgery. Be very, very clear that you want excision over ablation. Request your surgical report and notes post-op so that you have them for your record and review. This also removes that uncertainty around what was done, what was removed, where lesions were found, etc. Be very clear on pre-surgical directions. If a doctor suspects bowel endometriosis, you will be required to do a bowel prep. This reduces the risk of infection. Generally, prophylactic use of antibiotics is unnecessary, but if you develop an infection post-surgery, you may need to take an antibiotic. Endometriosis surgery is a big decision, and it's completely normal to have questions. Remember, the goal of surgery is to improve your quality of life, and with the right preparation and recovery plan, it can make a positive difference. If you found this video helpful, please give it a thumbs up and subscribe for more endo content. And if you have any questions, feel free to drop them in the comments below. Thanks so much for watching, and if you have an upcoming surgery, good luck.